Hello everyone, welcome to the Psychology Career Guidance session. I'm Dr. Geeta Singh. I'm a clinical psychologist. I have done my MPhil in clinical psychology from Central Institute of Psychiatry, Ranchi, and PhD in clinical psychology from All India Institute of Medical Sciences, New Delhi. I receive plenty of messages on a daily basis where students and professionals have asked a number of questions regarding how to proceed in the field of psychology, what is the difference between counseling and therapy, what is the required eligibility to register with Rehabilitation Council of India, and also the career opportunities available in the area of psychology. Therefore, I believe this session will help and encourage you all to excel in your knowledge in the field of psychology and find your career pathways in India. I would suggest you all get updated regarding the novel development in the area of mental health and also go through the Mental Health Care Bill, Rehabilitation Council of India Act, Person with Disability Act, etc. It is highly recommended that you always go through authentic sources to explore information about anything. So, to start a career in the field of psychology, one should have at least a master's degree in psychology. The post-graduation qualification in regular mode is always preferred over distance mode qualification. After completion of this degree, one is known as a counselor or psychologist and can provide counseling services in different setups based upon their subject of specialization at PG level. It is important to note that a counselor can provide counseling services and not the therapy. There is a difference between the counseling and therapy, which I'll explain later. There are a number of career opportunities available after PG in psychology. A counselor can work with non-clinical population, or you can say normal population, those who are not diagnosed with mental disorders. People visit counselor because they don't feel comfortable discussing their issues with family, friends, or colleagues. There may be adjustment related issues, there may be examination stress, procrastination, interpersonal relationship related issues, etc. So the focus of counselor remains on the wellness and prevention of illness. As counselor, one can work in different healthcare setup to provide counseling services. For example, one can work in psycho-oncology area, in NGOs working in different areas. One can also work in school setups as a school counselor. But schools nowadays prefer people with diploma course in guidance and counseling conducted by NCRT. One can work in industrial setups as well as industrial psychologist. The role of these psychologists are to increase productivity in the workplace, screening procedure for new applicants to enhance the quality of workplace, to counsel employees on personal and work related matters, and to improve work behavior. One can apply for scientist position in Defense Research and Development Organization, that is the DRDO. After PG in psychology, there is also an option to join research projects as field investigator or JRF or SRF at various government institutions. These projects are funded by a number of government agencies like ICMR, ICSSR, UGC, DST, DBT, etc. One can also join teaching profession with NTA UGC net qualification. So this was all about career opportunities available after PG in psychology. I would like to highlight that currently there is no regulatory body or council for psychologists or counselors in India. Rehabilitation Council of India is the regulatory body for rehabilitation and clinical psychology professionals only. Hence, without license from RCI, one cannot work with clinical population. And any person practicing as clinical psychologist without RCI registration is punishable before the law. You can see here a recent vacancy in DRDO where they have asked for PG in psychology along with net qualification. Now, it is important to understand the basic difference between the counseling and therapy. Counseling is generally a short term process and focused on potential solution to a current problem associated with a specific situation. For example, crisis management. It incorporates guidance, support, and education to help people identify and find their own solutions to current problems. However, therapy is medium to long term process that focuses on long standing thoughts, feelings, and behavior that have significantly impacted an individual's personal, occupational, and social functioning. Counseling do not emphasize into the past, for example, the childhood experiences, development history, etc. Therapy is intensive than counseling as it uncovers or deals with the historical root of the illness. Psychotherapy always follows evidence-based approach that is scientifically proven. It is important to note that one should have a license number from RCI to practice psychotherapy and also to start private practice in India. Participation in 2 days or 15 days workshop in particular therapy can only help you for exposure purpose and gaining certificate of participation. But you cannot call yourself a therapist or clinical psychologist based on your participation in these workshops. I have listed here RCI registered psychology courses. You can also visit RCI website for a list of institutes conducting these courses and details about the courses. So one can go for RCI registered professional diploma in clinical psychology. The qualification required to apply for this course is PG in psychology. This course is of 1 year duration. After completion of this diploma, one is known as clinical psychologist associate and they are eligible to work with clinical population and to be considered for specialist post in a healthcare setting, but not for faculty appointments in the field of clinical psychology teaching and training. Then there is MPhil in clinical psychology. The qualification required to apply for MPhil is PG in psychology and regular mode is preferred at most of the institutes. The duration of this course is of 2 years. After completion of this course, one is known as clinical psychologist and the position of clinical psychologist is considered higher in terms of authority, competency and responsibility than clinical psychologist associate. Following are the roles of a clinical psychologist. Clinical psychologists can play important role in the diagnosis and treatment of patients with clinical disorders using various modes of psychotherapy. They play important role in rehabilitation process with the patients diagnosed with mental illness or patients with disabilities. They can join teaching and training in core and allied areas of clinical psychology. They also play important role in administrative and decision making responsibilities in mental health area. They can also provide expert testimony in the court of law assuming different roles. There is an option of Side A in clinical psychology. It is applied clinical doctorate degree. It basically focuses on core areas and sub-specializations. It's of 4 years duration. After completion of your MPhil, you can directly take admission into the third year of PsyD. Currently, as per my knowledge, there are only two institutes running PsyD in clinical psychology. If you want to work as rehabilitation psychologist, then you can apply for MPhil or diploma in rehabilitation psychology. The basic eligibility to apply for these courses is your PG in psychology. Rehabilitation psychologists work with patients diagnosed with sensory, motor, or other developmental disabilities. Though MPhil in rehabilitation psychology is obviously higher in terms of authority, competency, and responsibility than diploma course. So this was all about RCI registered courses to practice in the area of mental health. But if someone is interested in research or teaching area, then there is option of PhD psychology. Nowadays, institutions mostly prefer students who have NET JRF qualification along with PG. After PhD in psychology, one can work as academician at university level. Then there is option of PhD in clinical psychology. Majority of the institutes prefer candidates with MPhil clinical psychology qualification along with some external fellowship such as UGC JRF or ICMR JRF for this PhD. Healthcare setups mostly prefer people with MPhil as well as PhD in clinical psychology for faculty position. Then after PhD degree, one can further continue for postdoctoral fellowship, that is PDF. There are more than 30 institutes running MPhil clinical psychology course registered with RCI. Just verify the details from RCI website. Those who are interested in forensic psychology kindly do understand that forensic psychology is considered as super specialty as clinical forensic psychology. It is the application of clinical psychology to the forensic setting. If you go by the APA definition of forensic psychology, it clearly states that it is the application of clinical specialties to legal institutions and people who come into contact with law. So before you opt for forensic psychology, you should have at least a basic professional qualification in clinical psychology. If you wish to know more about this area, you can visit a webinar conducted by Dr. S.L. Vaya, which is available on YouTube through the link given here. Though I am not an expert of sports psychology, but based on my experience, I can tell you that in India, people with MPhil in clinical psychology, along with some specialization in sports psychology, are given preference for the post of a sports psychologist. And same stands true for the post of child psychologist. I have shared here a sports psychologist vacancy for the reference purpose. They have asked for MPhil clinical psychology or sports psychology for the post of sports psychologist. Those who wants to do preparation for MPhil entrance examination, they can study general psychology thoroughly, abnormal psychology, social psychology, basic information about ICD and DSM, also go through research and statistics, major therapeutic approaches and the background theories, also get updated about Mental Health Care Act and other developments in the area of mental health. NIMHANS, CIP, IBAS are the primary institutes in this area. These institutes don't ask for fee payment, even you get monthly stipend during your MPhil course. So this was all what I had to say. I hope this session helped you to clear your doubts, especially related to counseling and clinical psychology area. For further queries, contact me through my Facebook page or Twitter account. All the very best. Thank you.